The mechanisms of drug actions is called A. Pharmacokinetics, B. Pharmacotherapeutics, C. Transport, D. Pharmacodynamics. And the correct answer is D. Pharmacodynamics. Pharmacodynamics is the study of the biochemical, physiologic, and molecular effects of drugs on the body. It is sometimes described as what a drug does to the body. Which effect the nurse expects may occur when using cholinergic agonists? A. Dry mouth, B. Tachycardia, C. Pupil dilation, D. Loss of bladder control. And the correct answer is D. Loss of bladder control.
I just lost control of my bladder.
Loss of bladder control is an adverse effect that can happen when using cholinergic agonists, whereas dry mouth, tachycardia, and pupil dilation are not the adverse effects when using cholinergic agonists. Which drug would the nurse expect to administer to a patient experiencing symptomatic sinus bradycardia? A. Atropine, B. Belladonna, C. Digoxin, D. Propranolol. And the correct answer is A. Atropine. Atropine is the first line medication for the treatment of symptomatic sinus bradycardia. The administration of atropine typically causes an increase in heart rate. This increase in heart rate occurs when atropine blocks the effects of the vagus nerve on the heart. Which assessment finding indicates that a patient is having an adverse reaction to catecholamines? A. Decreased glucose levels, B. Rapid fall in blood pressure, C. Palpitations, D. None of the above. And the correct answer is C. Palpitations. Catecholamines are responsible for the body's fight or flight response. Dopamine, adrenaline, and noradrenaline are all catecholamines. Which drug does the nurse recognize as a catecholamine? A. Dopamine, B. Albuterol, C. Prazosin, D. Labetalol. And the correct answer is A. Dopamine. Dopamine is a catecholamine, while albuterol, prazosin, and labetalol are not catecholamines. Barbiturate anticonvulsants are effective in treating all of these seizure types except A. Partial seizures, B. Tonic-clonic seizures, C. Febrile seizures, D. Absence seizures. And the correct answer is D. Absence seizures. Barbiturate anticonvulsants can treat all seizure types except for a specific type of seizure known as absence seizure. The effectiveness of levodopa can be reduced when taking A. Pyridoxine, B. Amantadine, C. Bromocriptine, D. Topiramate. And the correct answer is A. Pyridoxine. Pyridoxine may rapidly reduce the effectiveness of levodopa in Parkinsonism. Pyridoxine is also known as vitamin B6. Anticonvulsants fall into several major classes, including A. Anticholinergics, B. Fluoroquinolones, C. Succinimides, D. Dopaminergics. And the correct answer is C. Succinimides. Which anticholinergic agent is used to treat patients with COPD? A. Atropine, B. Pantoprazole, C. Budesonide, D. Ipratropium bromide. And the correct answer is D. Ipratropium bromide. Ipratropium bromide is an anticholinergic drug used in the control of symptoms related to bronchospasm in COPD. Which leukotriene modifier's absorption is decreased by food, requiring that the drug be given 1 hour before or 2 hours after meals? A. Zileuton, B. Montelukast, C. Zafirlukast, D. Nidocromil. And the correct answer is C. Zafirlukast. Zafirlukast is used to prevent asthma attacks. Zafirlukast is in a class of medications called leukotriene receptor antagonists. It works by blocking the action of certain natural substances that cause swelling and tightening of the airways. Food reduces the bioavailability and the amount of zafirlukast that is absorbed in the body. It should be taken on an empty stomach 1 hour before or 2 hours after a meal. To work properly, zafirlukast must be taken every day at a regularly spaced times even if your asthma seems better. The nurse is caring for a female patient with IBS whose primary symptom is diarrhea. Which drug does the nurse anticipate giving? A. Elocetron, B. Bisacodyl, C. Famotidine, D. Docusate. And the correct answer is A. Elocetron. Elocetron is used to treat women with severe irritable bowel syndrome who have diarrhea as the main problem. It is not a cure, but it may help to decrease abdominal pain, sudden urges to have a bowel movement, and diarrhea. This medication is not recommended for use by children because of the serious side effects that have been seen in adults. Urinary tract antispasmodics are used to treat A. Overactive bladder, B. Erectile dysfunction, C. Hypertension, D. Seizures. And the correct answer is A. Overactive bladder. Urinary tract antispasmodics are used to treat overactive bladder. Desflurane is which type of anesthetic? A. General, B. Local, C. Topical, D. IV. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.